Well, on behalf of the investigators of this study, it's my pleasure to be able to present these data today. And let me echo the thanks that was offered earlier to our patients who give of themselves to participate in these studies, both for their own benefit, but for those other patients who are similarly afflicted. So these are the results of the PERSIST-1, a phase 3 study of pacritinib versus best alternative therapy in the disorder of myelofibrosis, which includes 3 groups: primary myelofibrosis and those which had evolved from polycythemia vera or essential thrombocythemia. As background, myelofibrosis is a myeloid disorder. It is a chronic myeloid neoplasm, which can impact patients with both significant morbidity in terms of splenomegaly, symptoms, and cytopenias, as well as lead to mortality through a variety of difficulties. These individuals can have difficult symptoms, which can have a significant negative impact on their quality of life in a variety of mechanisms, everything from fatigue, night sweats, bone pain, fevers, and severe itching. As early as 1 year from the time of diagnosis, these individuals can run into difficulties with cytopenias, particularly thrombocytopenia, anemia, and red cell transfusion requirements. Thrombocytopenia in particular is a negative prognostic factor for this disease, as well as a predictor of transformation to acute myeloid leukemia. The limitation in our therapies for myelofibrosis have been that we have not had agents which have been able to simultaneously improve the splenomegaly and symptoms from which patients are afflicted, while also impacting in a favorable way their cytopenias. The PERSIST-1 study, it was a randomized study with a 2-to-1 randomization between pacritinib at 400 milligrams a day versus best alternative therapy in individuals with intermediate and high-risk myelofibrosis, with a distinguishing characteristic of this phase 3 study that there was no required platelet count at entry in terms of a minimal platelet count, as well as allowing patients to be fully anemic. In terms of top-level results, the primary endpoint revolved around splenic volume reduction. This had been identified in this field as a value of greater than 35% as being by volumetric studies as the endpoint. In the intention to treat population, pacritinib was superior to best alternative therapy, 19.1 versus 4.7%. The evaluable population were individuals that had both a volumetric scan at trial entry and at week 24. This is the graph which you see here, 25% versus 5.9%. What you notice is that the majority of patients receiving pacritinib had a reduction in spleen size, with the threshold for response being here, identifying that number, but many individuals having evidence of benefit at other levels. We also see that the degree of activity of the best alternative therapy arm is very modest. Now, a particular point of emphasis in this study is activity in individuals who do not have a current therapy available to them, in particular individuals with significant thrombocytopenia, as there is no therapy indicated for these individuals currently. In this group, with a baseline platelet count of less than 50,000, we saw that percentage achieving the primary endpoint to be vastly superior in both the intention to treat and evaluable arms, with no respondents amongst the best alternative therapy arm. Similar experience if we look at the broader group, over 100,000. As we look at impact on survival by splenic reduction, compared with a group that has less than a 10% reduction in spleen volume, we noticed very favorable hazard ratios for individuals achieving a spleen reduction between 10 to 20%, as well as those above 20%, highlighting the importance of splenic reduction in impacting the outcomes on these patients. We did not see such favorable impact from the best alternative therapy arm. The other key component was improvement in symptoms, and similar to the improvement that we saw with splenic volume reduction, individuals, both the entire evaluable population, with particular emphasis on those that have thrombocytopenia, show the differences that we observed in terms of reduction in disease-related symptoms in individuals without alternative options. So we would conclude that there's a significantly greater proportion of patients achieving a response for splenic volume with the therapy with pacritinib, regardless of the baseline platelet count. The significant treatment effect is particularly notable in the high-risk patients with baseline significant thrombocytopenia. There was significant reduction in the total symptom score, which is our aggregate tool for assessing the symptomatic burden in these patients. A significant higher portion of patients became red cell transfusion independent through the course of this study. We observed 25% of individuals who entered as being red cell transfusion dependent, becoming red cell transfusion independent. Patients with a baseline platelet value of less than 50,000 had a mean increase in platelet count of 35% by week 24. Based on these preliminary data, we view that pacritinib may be an important option for a range of individuals with myelofibrosis, in particularly those that have baseline cytopenias. Thank you.